Hello everybody and welcome to our Masters of Public Health webinar. I want to say a warm welcome to wherever you are in the world and whatever time it is. We're so pleased that you've joined us today for this really informative session. So my name is Hannah Bennett and I'm the Recruitment Conversion Manager for the School of Health and Life Sciences here at Glasgow Caledonian University. Today we are joined by Martin Murchie, who is the Programme Leader for the Masters of Public Health programme. Martin will deliver a short presentation to give you a bit of an overview of the programme, followed by an opportunity for you to ask any questions that you may have. So please feel free to post your questions at any time using the public chat, and we will do our very best to answer as many as we can during the Q&A session at the end. Just a quick note to say that today's session is being recorded, so we will share the slides and the recordings with you afterwards, so you'll have everything that you need to refer back to. So I'm just going to load the slides up for you and then I will hand you over to Martin. So thank you very much. I'll put myself on mute.
Thanks, Hannah. Thank you. Hi, everyone, and welcome to this session on the Masters of Public Health programme. As Hannah said, I'm Martin Murchie and I'm the programme lead for the Glasgow campus. We have another programme lead, Abdul Razak Abukara, for the London programme, but both programmes are exactly the same. So you have me today presenting for both programmes, but just different campuses. So first of all, I wanted to let you know a bit about our philosophy around our Masters of Public Health. Obviously, public health has been and continues to be an extremely important part of health and has developed through many different waves, up to 5 different waves of public health from the past till now. And that has kind of set the scene of our programme and also our programme trying to meet the needs for a modern public health workforce. So our philosophy for the Masters is hopefully to prepare and develop all our students to be able to prevent disease, promote health and protect the well-being of the public. And we do that through a variety of education, research and public health practice and service. Following on from that, we have the programme aim that again kind of reiterates the same key areas. So public health for us and for practitioners who leave our programme, their aim is really about prevention of disease, promoting health and also protecting well-being, as I said in our philosophy. And as you can see, we do that through our education, research and our public health practice. But we also attempt to follow and do follow the 3 key domains of public health practice as defined by the UK Faculty of Public Health, and that's health protection, health improvement and health services. So you can see how they weave through our Masters of Public Health aims and philosophy. Some of the feedback we've had from our students who have graduated, you can see now on the board. So you can see that there's a variety of positive feedback we've had from our students who have completed our programme. And our programme's been running for many years, very successfully, and with very successful progression and awarding student numbers within that as well. So you can see there's a lot of really good feedback that we've had in terms of how we look not just locally at the UK, but we'll also take a global look through the programme. We have a variety of lecturers within the Masters of Public Health with a variety of different backgrounds of knowledge and experience. So we have people from research in public health, we have facilitators from policy development in public health, we have people from practitioners like myself from practice in public health. So a real variety that we have in terms of to give you a rounded knowledge and education and research to public health practice. The slide that you're seeing in front of you is based on if you were to become a January start with us into the programme. So our January starts would be entering what we call trimester B within the MPH programme. And within that trimester, you have 4 modules to study. You can see here in white, we have social action approaches to public health, applied statistics for data analysis for public health, and evidence-based public health are the 3 core modules that everyone would take in trimester B. However, all students have the choice of one of the following 3 optional modules, and you can see them in yellow within the trimester B column. So you can see you can choose either infection prevention and control in a global context, you can study health economics, or you can study navigating the policy. You can study any one of those 3 alongside the 3 core modules for trimester B. If you're a January start, then in trimester C, which is really roughly May to August, that's a holiday period for you. And then you recommence your programme in trimester A, which would be September 20, as we call 26, 27, but would be September 26 would be that. And within your trimester A period, you would be looking at advanced research methods, because they are key to be building your protocol and what you are deciding to do for your dissertation in the next trimester. You do the principles and theory of public health practice. We do epidemiology, principles and application in the evaluation of practice. So you can see that within trimester A, there are 3 modules that you must undertake, but one of them, advanced research methods, is a double credit module. So that's quite a large module for you, hence why there are only 3 rather than 4 within that trimester period. Both trimester B and trimester A are covering the core elements that are mapped to the Faculty of Public Health competencies in terms of developing modern practitioners for public health. On the achievement of Tri A, you would then move into Tri B again, which would be January, roughly January, February 27, to complete your dissertation, which is roughly about a 16,000 piece assignment, which can be a structured literature review, or it can be a piece of original research covering all the key details of ethics, etc., that have to come along with original research. But you would have the choice within the dissertation in terms of what you would have to do, considering your time frame, because it's a 15-week trimester for dissertation in Tri B. So you have to keep that in mind in terms of the realistic achievement of what you can do in that period of time. But you have the choice of the topic that you want to explore. You choose that, and you're giving a supervisor to help supervise you through the process through to submission. On the completion of all these academic credits that you can see here in the trimesters, you would then achieve 180 credits at level 11 for award of the Masters of Public Health. Obviously, depending on your academic grades over that period of time, would also depend whether you're awarded a Masters of Public Health, a Masters of Public Health with merit, or a Masters of Public Health with distinction. I just wanted to show you them on another slide to give you an idea. Like, as Hannah said, this will be available to you after the presentation. And I wanted to let you know about the variety of assessment strategies that we have within the programme. So you can see there's a variety of ways that we assess your knowledge and education that you've gained within the modules and across the length of the programme. And they range from 3,000 word written assignments to poster presentations, to word presentations in class, in terms of case studies, examinations. So a variety of different ways of assessing your knowledge and education for you through all of those modules. The optional modules that I mentioned already are obviously navigating the policy. Very important for public health practice is understanding policy and how to navigate that and implement it and develop it when required. The other option modules, infection prevention and control in a global context. So we're looking at how infection prevention measures are applied, not just in the UK, but across the globe. We're looking at that. And in health economics, we're looking at the importance of balancing the financial envelope along with public health needs in terms of how do you meet the needs of the public with the financial envelope and the money that you have to deliver services, interventions. The outcomes awards, obviously we're talking about the Master of Public Health award here in the programme. However, you can exit with less academic credits and still receive a public health award from the university. So that would be if you only achieved 60 academic credits, that would be a postgraduate certificate in public health. If you manage to achieve 120 academic credits, you would then receive a postgraduate diploma in public health. But obviously, I'm sure everyone would probably be aiming for 180 credits, which would be the Master of Public Health. You would exit with that. But we do have different award points for different exit points with awards, sorry, for different students' needs and in terms of what you would like to leave the programme with. You have myself within the MPH team. So you have me as the programme lead for Glasgow. We have Razak, as I had mentioned earlier, for the programme leader for London. So whether you're interested in Glasgow and London will depend on your programme lead is, and also depend on your programme team. And we have a programme coordinator for Glasgow, Nikki Maguire. So if you were coming to the Glasgow campus, you would get to know Nikki and I very well as your programme core team, along with the MPH academic team that would be providing a variety of your teaching and education sessions. There's a variety of different support services within the university alongside the programme support. So obviously you would have the academic team under the Masters of Public Health. And like I said, there are a variety of different, from a variety of different backgrounds, professional backgrounds, whether it be researchers, medics, nurses from practice, people who have developed policy, just to name a few, people who are into epidemiology and statistics. So you have a variety and you will gain knowledge and education from all of those staff members that are within the MPH team, whether that be Glasgow or London, to be honest. But also alongside that, there are other support services that we encourage you to access for your time during the programme. So one of them is the Learning and Development Centre, which looks at you supporting you to develop your academic writing at master's level, because that can be something that's very new to you as a student or something that you would like to work on. So Learning and Development Centre deliver sessions throughout all the modules, but also you can see them on a one-to-one basis. We also have the library, which are very key in your access to academic literature and research, which you will require, one, to add breadth and depth to your knowledge and learning, but also in terms of very key in terms of for searching for your literature and academic research in relation to your assessments within the modules and within the programme. We have wellbeing services. So we have wellbeing services that offer support, counselling, peer support. So a variety of that is available for you during your time as a student. We have a visa team if you are an international student and have some visa issues or questions, then we have a core visa team that you can also access. We have a careers advice service, because obviously either working during your time within the programme is very important for some students, but also possibly looking at your future career aspects and what you would like to do post the achievement of your MPH2. We have the Students' Association, who can help you and support you with a variety of different areas, but also have things like they'll have clubs and events that you can join as well as your time as a student within GCU. So widening your peer network and in terms of enhancing your student life at the Glasgow Caledonian University. We also have our internet cafe that you can access. And last on the slide, but not least, you will be also allocated a personal tutor from the core MPH team itself. And that personal tutor would be your personal tutor throughout your time within the programme. They would help you navigate academic questions, future career aspirations, and also help you with some pastoral care if that is required too. So everyone would have that allocated within the first few weeks of joining the programme. And that feels like a whirlwind introduction to the Masters of Public Health there for you. But it's just to give you a basis and a flavour for it, and hopefully maybe stimulate some questions or answer some questions that you had. Anyone get any questions they want to pop in the chat or ask just now?
That's brilliant. Thank you so much, Martin. So we've come to the end of our presentation part of the session today, but as Martin's just said, if you have any questions for us at all, if you can just pop them into the public chat, I'll kind of monitor that, so I'll come in and out if there's any that come in, and I'll read them out to Martin and he can answer them for you.
I'll maybe take the slides back to the trimesters so you get a better idea of that again. Any questions at all? Just pop them in the chat. Nothing coming through. We'll just give you a few more minutes just in case it's taking time to type. Obviously, by joining Glasgow Caledonian University, you'll be joining the modern top university as voted for within the UK as well. So it's a very prestigious university to join.
Martin, we've had one question come through.
Right.
Someone said, I don't quite understand the programme structure. I don't know if you could maybe go into that in a wee bit more detail.
Yeah. So by the programme structure, what we have on screen just here. So the programme is made up of what we call 3 trimesters within the university academic calendar. So trimester B, which is the very first one, the Tri-B 25-26 column you can see here on the screen, actually runs, and these are rough dates because I don't have the actual academic calendar open, but roughly runs from mid-September to near the end of December with, near to the beginning of December, with your assessment being probably somewhere mid-December period. So you'd be studying social action, applied statistics, evidence-based during that time, plus one of the yellow optional modules. Now, those modules would most likely run over Monday to Thursday. So you may be in for a half a day for one module on a Monday, half a day for another module on a Tuesday, or you may have a module session in the morning and the afternoon, just depending on how it's being delivered. But roughly, they're delivered over 4 days during September to December period. And you'd be expected to attend those classes, obviously. So that would end roughly at the beginning of December, and then you would have your assessments submitted mid-December, with your results being released to you usually around about January sometime, and they would then go to what we call an assessment board to be ratified. All being well with that, you would move on to trimester A, which would then be running in from roughly the February 2026 period. February. No, hang on, let me get this right. I'm in the wrong bit. I'm confused. I'm really sorry. I'm confusing the whole thing because I've got September in my mind. So let me start again. If you're a January start, trimester B will actually run, and apologies for causing more confusion, trimester B will actually run from roughly February through to May 2026. So that's the very first column that starts with social action. So my apologies. Your assessments would be sometime in May 2026. You would then receive those results roughly about 3 weeks after that. And again, there'd be an assessment board in June. And you would then be on holiday if you're a January start through the months of part of May, June, July, and August. You would be roughly on holiday those periods. On achievement of that trimester B module, so that's the module, just to reiterate again, that was running, the modules are running from February to May 2026. On the achievement of that, you would then return to university in September 2026 to start trimester A. And trimester A is the one that has advanced research methods, the principles and theory, and epidemiology being delivered over that trimester period. And that trimester A period runs from, like I said, September roughly 26 to December 26, with your assessments being due in December 26. So in achievement of that trimester A period, you would then have a break over what we call the Christmas and New Year period, or the festive period, and you would then return to university for trimester B again, but this time it would be commencing in roughly January, February 2027. And that would be to commence your dissertation, as long as you'd achieved enough academic credits over the previous 2 trimesters to commence that. So your dissertation would probably run from roughly January, February 2027 through again to roughly the May period of 2027 as well, where your dissertation would be submitted and would be marked at that point. If all academic credits were achieved, which is 180 in total, at the end of the programme, then you would be awarded your Master of Public Health. And your graduation for that would be possibly, might be a summer, but could be a winter graduation, maybe like November, etc. Around that. So, but you would have your award way before that. You would have your award after the assessment board met in June 2027 to ratify all your marks and your dissertation mark as well. So I'm hoping that explains it. I'm sorry I got you a bit confused at the beginning there, but really if you're starting in January, that's trimester B, and that's January, February 2025 through to May 20, January, February 2026. Sorry, I don't know why I'm so confused by dates today. January 2026 through to May 2026. Then you'd have a trimester C break, which is a holiday period, returning in August, September 2026 through to December 2026. Then a festive break for a few weeks, and back into a further trimester B, which would be January, February 2027. So I'm hoping through that confusing explanation that helps a bit with it.
Thanks, Martin. That was very informative.
I'm
I've
sorry.
had another question. No, you're all right. I've had another question come through, and they're asking about the possibilities of getting a near or fully funded opportunity for the programme. What I would say to that is there's a range of scholarships available. If you want to go and have a look at different types of scholarships that the university offers in general, you can then contact the scholarships team. So if you just go onto the website, you can type in scholarships and funding, and the team will come up and you can send them an email, and they'll let you know if you're eligible for any other kind of types of scholarships or funding. Martin, I don't know if there's anything that you want to add to that, or if that's kind of sufficient.
That's sufficient. There's nothing out with that really that we have, Hannah. Yeah.
Okay, perfect. Thank you. Let me just check again if there's another wee question coming through. Nope, it just hadn't cleared for the last time, the wee notification. Oh, somebody's come through and said, are there practical opportunities throughout our MPH, something like shadowing a research programme or public health related internships?
So there are no internships for whether you study at Glasgow or London campus. We do not have any internships, unfortunately. However, what we do have is we bring in external lecturers and other people who are from public health disciplines and who are in public health practice. So we bring them in as external and guest lecturers in terms of to allow you to get some of that feeling of from practice or from areas within public health without actually you being within the public health field itself. There are opportunities to get involved in research. GCU has a huge research department who often asks students to participate as recruiters or other parts of research. There's nothing that actually, it doesn't link directly with the programme, so we don't have part of the programme or a module that gets you into the research department, although we take you through advanced research methods and the importance of why you must understand them, and also try to apply that to your protocol for your dissertation. However, but there are opportunities that our research department within GCU, which is wide and varied around the areas of public health, they do put a call out for people to participate, and also for you to go along to other sessions that they may be delivering on particular pieces of research that they're working on and they're reporting on.
That's brilliant, thank you. I'm just keeping a wee eye on the chat just now. There's nothing else that has come through, but we'll stay on for another couple of minutes just to see if there's any other kind of questions that come through. So please, if you have any other questions around the course, now really is your opportunity to speak to one of the programme leaders and get them answered from somebody who knows exactly what the programme is about. So please utilise this time effectively. just pop the questions into the public chat and I'll read them out for you.
Anything else you'd like me to answer? If you do decide to join us at GCU, which we hope you do, we also have an induction session as well to the programme. Again, covering some of the key elements here, but also getting you to know and meet the Students' Association, our head of department, our dean, etc. So there's some really nice induction programmes and inductions across the university that you can join in too. And also during your time for international students, we have international events where we get put on events for all the international students within the university across programmes. So you might get to meet some other peers from other programmes like engineering or business, etc. as well.
Okay, I think that looks like that is all the questions that we've had. Oh, of course, as I say that, something comes through. So this is actually a very specific question about somebody's admissions. So I think what I would say to this person is to contact our admissions team. So if you contact inquiries@gcu.ac.uk, they'll be able to let you know if you're eligible to apply for the programme or not. So we don't really want to talk about anybody's specific circumstances on the kind of public platform. So if you just give them an email, they'll let you know.
There's obviously criteria around entry criteria on the GCU MPH website as well, if it's useful. Too, you can have a look there also.
Oh, I think someone is just typing, so I'll give it another couple of minutes until they finish.
Cool.
Yes, I can see your text. Yep. Do you have a question? Okay, so yep, they've got a question, so I'll just wait until they've finished typing.
No worries, just pop it in the chat.
So they've said, what will be the assessment methods in each of the different semesters or trimesters?
Yeah, of course, we can look at that on that following slide there. So, Mosina, as you see here, when you join in trimester B in January, then in social action you have a 3,000 word written assignment or an essay as we would call them. In evidence base, you would have a poster presentation, which is roughly equivalent to 3,000 words. And then depending on the other module that you took during that time, whether it be navigating the policy, infection prevention, or health economics, because the ones in orange that you can see on the screen are optional during that time. So they would be, it would depend on which one of them you took. But again, that ranges from like a presentation within class, or maybe a 2,500 word case study, or an examination through it. What's missing there is applied statistics, which is an examination as well. Just realised it's not on the slide, which happens in trimester B also. So that would be an examination. So if you were drawing from January through to May, you'd have a variety of written assignments, poster presentations, possibly an exam, and also a verbal presentation within the module. And if you go on then to look at the when you would come into trimester A, later on after achieving trimester B, you can see that for that trimester, it's predominantly written assignments for in there. So there is coursework in advanced research, which is really like a protocol, but there's also 2 further written assignments within trimester A for principles and theory and also for epidemiology. So what we've tried to do is make a variety of different assessment strategies for you through the programme to give you some variety and other ways to achieve and demonstrate your knowledge in learning. Hopefully, Marcina, that may answer the question. Yes, so it's a written assignment, Marcina, exactly. So it'd be 3,000 words you would write on a particular topic in that module. No, so your presentation would be, your only presentation would be an evidence-based, possibly, where you would be creating a poster on a particular topic in public health. Or if you took navigating the policy context, then they have a presentation again within there, a kind of verbal presentation, that is. So it depends on the module that you're in, depends on the assessment that they're asking you to complete at the end. But we talk you through all of these, Marcina, as well, and give you academic support through them all too. You're welcome.
So I've had another question come through and directly to me. I don't know if you can actually see this or not, but the person is asking about deferral. So that again would need to go back to admissions. So you would need to contact the admissions team. If you have already had an offer, you can apply to them via the email address which is in your offer. If you've not, again, if you contact our inquiries team, so inquiries@gcu.ac.uk, and they'll be able to let you know if you will be able to defer.
Lovely. Hannah, I can see Sajid's question that you'd said again about going to admissions. I was just going to add, if that's okay, that if you look at the entry criteria, Sajid, on the MPH website for GCU, then in that it talks about the types of degrees we're looking for, and that usually is degrees that are related to health, but not solely related to health. So your anaesthesia technology, I would assume, has some relation to health, and your transcript from that award, which would be asked for in admissions, would clarify that as well. Any final questions from anyone? You're welcome, Sajid.
I think that might be all the questions for us today.
Okay.
If anybody has any final ones, there's nothing that's came through there for a couple of minutes now, so I think that might be us. If anybody does have any further questions, you can always contact the inquiries team, like I've said a couple of times, and somebody will either get back to you from the team or forward it on to the relevant department within GCU, so somebody can get back to you there. Just triple checking nothing's came through there. No. So I just want to say a big thank you to Martin today for his time and for a really great presentation and for answering all of your questions there so thoroughly. As I've mentioned at the beginning, the session has been recorded and we will email it to all of the attendees along with a link to the presentation slides, so you can refer back to all of these kind of notes at any time that's convenient for you. Like I said, if you have got any further questions, you can email inquiries@gcu.ac.uk. We hope to see you all for your induction. We'll get to meet Martin and the rest of the team in person as well. So Martin, would you like to say a few kind of final words just before we wrap up?
Yeah, we would more than welcome you all to come on the programme. We'd be delighted and to support you through the programme for the MPH. And thank you for coming to the webinar today, and also to you, Hannah, for also hosting us.
Thank you. So I think that's us. Thank you very much.
Thanks, everyone.